Welcome back to the invisible science of smiles. Today we are going to talk about what you don't see and why oral health plays a far bigger role in longevity than most people realize. Don't take me wrong, I love aesthetic dentistry. I love creating beautiful smiles. But what we are talking about today goes far beyond appearance, because oral health sits at the crossroads of one of the most controversial and misunderstood drivers of chronic disease, chronic inflammation. So here is why this matters. Globally, around 70 to 75% of all deaths every year are caused by chronic diseases. Cardiovascular disease alone accounts for roughly 1 in 3 deaths worldwide. Cancer follows closely behind, and diabetes, while often underestimated, dramatically amplifies the risk of both. These are the most deadly diseases of our time, and here is the uncomfortable truth. They are rarely caused by a single thing. They develop slowly through a buildup of risk factors. And one of the most common, least discussed, and most underestimated of those risk factors is chronic oral inflammation. Oral inflammation can quietly lower the system day after day, year after year. Today, I want to show you how. Modern medicine no longer believes in single-cause disease. Heart disease doesn't come from just high cholesterol. Diabetes doesn't come from just increased sugar. Cancer doesn't come from just some cells that are damaged. Disease develops when multiple risk factors accumulate until the system can no longer compensate. Think of it like loading a scale. Each risk factor adds weight. Genetics, lifestyle, metabolic health, stress, environmental exposure, and one that's almost always ignored, chronic inflammation, especially from the mouth. Oral inflammation doesn't necessarily pull the trigger, but it loads the gun. To understand oral chronic inflammation, we need to understand 2 different worlds. So let's start with the world that everybody can recognize and that we can see, the macro world. In the oral cavity, we can see different tissues, hard tissues, for example, the teeth, soft tissues like the gums and oral mucosa, and muscles like the tongue and facial muscles. These structures are visible to our eyes. When there is chronic inflammation, we can see symptoms: red gums, bleeding when brushing, bad breath, gum recession, and possible gum pocket. When your dentist says, "Your gums are a little bit inflamed," most people assume they're brushing too hard, maybe they missed flossing, it's normal, and it'll settle. But here is the naked truth. Bleeding gums is not normal, as it's not normal for the skin to bleed. The gums will bleed when they are inflamed. In the absence of inflammation, there's no bleeding. Bleeding gums are usually painless, which usually convinces people that there is no real problem. But clinically, we know this. Periodontitis, or gum disease as is commonly called, is a chronic inflammatory disease that often progresses silently. By the time teeth feel loose, abscesses appear, bone loss has already occurred, and the gums have already had irreversible damage. Bleeding is just an early warning. Pain is a late symptom. But once you get pain, it's usually too late. When I ask my patients, what do they think will happen if they don't treat their gum disease? Usually the response is, I will lose my teeth. And this is correct. But what they don't realize is that it doesn't stop there. The implications of gum disease in general health go far beyond the issues of not being able to chew or losing neurological feedback that teeth give to the brain, or supporting the existence of bone in both arches. We will talk more about this later on, so stay with me. The second world that we have is the microscopic world, the ones that we cannot see, and actually decides the outcome. Your mouth contains hundreds of bacteria species. We have the second biggest microbiota in the body, with around 700 species. And there is also some pathogens. These bad guys account for about 20 species, but they can cause a lot of trouble. Many times, People ask, so why don't we get rid of the bacteria? But the answer is not to get rid of all the bacteria. The answer is to achieve the balance. When the microbiota environment changes and we have a disbalance, pathogenic bacteria dominates. This leads to chronic inflammation. These bacteria usually are found in oral biofilm. We'll talk about biofilm a little bit later. They become organized, they protect themselves from saliva, oxygens, and even from your immune system. Oral dysbiosis then follows, and gum disease is the end result. Research shows that advanced gum disease is associated with high levels of gram-negative anaerobic bacteria, release of LPS, lipopolysaccharides, which are powerful inflammatory toxins. This invisible bacterial activity drives what you see in the mirror. Microsigns are symptoms, but the microimbalance is the cause. To have a better understanding on how this chronic inflammation and destruction of oral tissues become a risk factor for chronic conditions, we need to understand the normal biology and the pathways that disease take. Healthy gums act like a seal border. Inflamed gums don't. When the gums bleed, studies show that bacterial toxins, inflammatory molecules can enter the bloodstream. This happens not just during dental procedures, but during everyday activities like brushing, flossing, chewing, swallowing. This is known as transient bacteremia and is very well documented in the medical and dental research. The immune system doesn't really care where inflammation comes from. Once these toxins reach the bloodstream, it affects the blood vessels, the liver starts responding, insulin signaling is affected, and the systemic inflammatory markers rise. This is why periodontitis is now recognized as a chronic inflammatory burden, not just a local mouth issue. So, if you think that gum disease only results on losing your teeth, you are out for a big surprise, because one of the root causes of the major chronic illnesses, and the research is now showing that is associated to pretty much every chronic illness. And why wouldn't? At the end of the day, the mouth is not isolated and is the entry to our bodies. So let's talk about the oral systemic connection. There's many systematic reviews and research showing that periodontitis is associated to cardiovascular disease, poor glycemic control in diabetes, rheumatoid arthritis, adverse pregnancy outcomes, neuroinflammatory conditions, Alzheimer's disease, cancers, and many others. It adds to the total inflammatory load of the body. And when the system is already vulnerable, that extra load can be enough just to push it over the edge. So the way I see it is like a cocktail. So we got all the ingredients, which are the risk factors, and when the combination is right, then disease will develop. So what really causes gum disease? Okay, so let's be very precise here. Gum disease is bacterial in origin, but not all bacteria will cause gum disease. Every tooth surface within minutes of cleaning becomes coated by a microscopic protein film. It's called the acquired pellicle. This happens in all the environments where fluids exist. This pellicle is normal. It protects and is necessary. After a couple of hours, bacteria will start then attaching to this pellicle, and we start forming what we call the biofilm. At the beginning, this biofilm is healthy. A healthy biofilm does not cause gum disease. In health, the biofilm is usually balanced, is dominated by commensal symbiotic bacteria, which we need for some functions. Immune system and microbiome coexist peacefully, and the gums remain stable. But if these biofilms are left undisrupted, they will mature, and the chemical and microbiological composition will change, and also its behavior. And this is what we call dysbiosis. At this point, pathogenic bacteria increases. Virulence factors are expressed, and the biofilm becomes inflammatory. We are no longer talking about plaque. We are talking about a pathogenic biofilm. So let's be very clear about periodontitis is a bacteria-driven disease. Multiple species have been identified as key etiological contributors, including Porphyromonas gingivalis, Treponema denticula, Actinomyces comitans, and Fusobacterium nucleatum. You might have heard of this bacteria before. So this bacteria will disrupt the immune signaling, manipulate the host defenses, is going to promote chronic inflammation, and is going to shift the entire microbial ecosystem towards disease. So the way I see it is, think about a neighborhood. In your neighborhood, it's all calm, peaceful, there's no problems. Then a gang member moves to the neighborhood. So people start getting a little bit cautious, but nothing is happening yet. But then other people move in, and then other members of the gang move in, and then all of a sudden we will think you can't live in that neighborhood because it's all these problems, it's unsafe, and then they have to call the police all the time, and then damage is going to happen. So this is pretty much what happens in gum disease. Inflammation happens because of the biofilm is pathogenic. There's too many pathogenic bacteria, and then the immune system is going to come and try to help, but because it's working 24 hours continuously to try to fight that bacteria, then there's going to be collateral damage. And the collateral damage that occurs is damaging the bone and the soft tissue. So the bacteria pulls the trigger, but the inflammation causes the damage. So risk factors will determine the severity of the disease. So there are several factors that affect the changes in the biofilm. They modulate the response to pathogenic biofilm. They will determine the transition from health to disease, how fast the breakdown of the tissues is going to occur, and how severe bone loss become. Some of these risk factors are poor oral hygiene, smoking and vaping, diabetes and metabolic disease, genetics up to some point, diet and lifestyle, systemic inflammation, stress and immune dysregulation, local mechanical factors, hormonal and autoimmune conditions, and the host susceptibility. This is why two people with similar plaque or biofilms can have very different outcomes. The Health World Organization includes periodontal disease as a major oral health condition with very high global prevalence and significant impact on health and the quality of life. Severe periodontal disease affects more than 1 billion people worldwide, making it one of the most common chronic inflammatory conditions globally. Oral diseases, including gum disease, affect nearly half of the world's population and contribute significantly to disability and economic burden. In Australia, gum disease affects over 40% of people over 30 years old and over 65% of adults over 65 years of age. The saddest part of this is that most of gum disease types are preventable, as many of the chronic conditions are. Now that we understand gum disease and how it affects our bodies, in the next episode, we are going to talk about the Big Five and the pathways that are shared between oral chronic inflammation and these chronic illnesses. So stay tuned. We will also discuss the importance of biofilm management and how it's different from what is known as cleans. For the time being, take care of your gums and your oral health. It might save you more than a tooth. Thank you for listening.